Today we're going to be talking about the HINTS exam. We'll be discussing how to perform the HINTS exam, who you would want to perform it on, and how it's helpful in differentiating peripheral versus central caused vertigo. The HINTS exam is composed of 3 separate tests. These tests include the head impulse test, a nystagmus assessment, and a test of skew. Typically, you only want to perform this exam on patients who present with acute but persistent vertigo, as well as observable nystagmus. We mentioned that this exam is helpful in differentiating central causes from peripheral causes. Central causes mean that the vertigo is most likely stemming from an issue having to do with the central nervous system. In the case of the HINTS exam, we are looking for signs that the patient could be suffering from a posterior stroke. Peripheral causes means that the problem is stemming from the peripheral nervous system. This could be structures of the inner ear, or it could be the vestibulocochlear nerve. It's important to distinguish between these 2 causes because, as we know, a stroke is a serious medical condition that requires immediate attention, whereas peripheral causes are benign and will often resolve themselves within 7 to 10 days. It's easiest to start this exam by performing a nystagmus assessment. Nystagmus is when the eyes move rapidly and involuntarily back and forth. The different types of nystagmus can be broken down into different categories based on eye movement. You can have vertical nystagmus, horizontal nystagmus, or a combination. Nystagmus can further be broken down into unidirectional nystagmus or bidirectional nystagmus. Nystagmus is identified by the fast beating component of the eye movement. This means that if the eye is beating to the right faster than it moves to the left, you have right beating nystagmus. On the other hand, if the eye beats to the left quicker than it moves to the right, you have left beating nystagmus. When performing a nystagmus assessment, it is important to ask the patient to look to the right and then to the left. If you notice that the fast beating component of movement changes direction, you have bidirectional nystagmus. During a nystagmus assessment, bidirectional nystagmus or purely vertical nystagmus can be indicative of a central cause of vertigo. This means that the patient may be suffering from a posterior stroke. The patient in these videos does not have vertigo, nor does he exhibit any nervous system findings. Thus, the signs that he tries to demonstrate may be exaggerated. That being said, let's take a closer look at what nystagmus might look like. This patient is exhibiting left beating nystagmus. We noticed that when he looked both to the right and to the left, the fast beating component of movement did not change direction. Thus, his unidirectional horizontal nystagmus is indicative of a peripheral cause of vertigo. The next part of the HINTS exam is the head impulse test. This test takes a closer look at the vestibulo-ocular reflex. This is the reflex that makes it possible to maintain a steady gaze when your head is moving back and forth. If you want to try this out, try to read the words head impulse test while moving your head right to left. You are still able to read those words because of your vestibulo-ocular reflex. This reflex is under peripheral control. Thus, if a person is not able to maintain steady gaze during this test, their sign is indicative of a peripheral cause of vertigo. However, if the patient is able to maintain steady gaze throughout the test, this is a more concerning finding, because if the patient is presenting with vertigo and has an intact vestibulo-ocular reflex, this means that the problem could be stemming from the central nervous system, and the patient may be suffering from a stroke. To perform this test, you will instruct the patient to look straight ahead, usually at the therapist's nose. The therapist will then grab both sides of the patient's head and slowly move it back and forth. Then, without warning, the therapist will quickly move the patient's head in either direction. This must be done quickly, usually over 60 degrees per second, in order to test the reflex. It should be noted that it might be more helpful to quickly jerk the patient's head back to center, as this will prevent over-rotation of the neck. Let's take a closer look at the head impulse test. In that video, the patient was able to maintain steady gaze throughout the test. This is more concerning because this means that their cause of vertigo could be the result of a stroke or central nervous system problem. Now let's take a closer look at a different finding from the head impulse test. In that video, you saw the patient demonstrate a horizontal corrective saccade. This happens when the patient is unable to maintain steady gaze while their head is moving. The patient's eyes moved off to the side and then had to refixate on the therapist's nose. This means that the vestibular ocular reflex is not intact. However, this is a better finding because it indicates that the cause of vertigo is a result of a peripheral problem. The final test in the HINTS exam is the test of skew. The test of skew is important because it can show whether or not there is brainstem or cerebellar involvement, both of which are central structures. This can result from abnormal input to the ocular motor nuclei. To perform the test of skew, you'll instruct the patient again to look straight ahead. You will then cover one eye with your hand. The therapist will then move their hand to the other eye, and when they do this, they need to observe the eye that was previously covered. If the eye moves vertically or diagonally, this means that their cause of vertigo could be central. However, if there is no eye movement and the patient maintains steady gaze, this means that the cause of vertigo is most likely peripheral. Let's take a closer look at the test of skew. Here we see the patient maintain steady gaze throughout the test. This would be indicative of a peripheral cause of vertigo. Now let's take a look at a different finding. Here we see the eye move up and diagonally. This would be indicative of a central cause of vertigo and is cause for concern. Let's review what we've learned. During the nystagmus assessment, you want to be sure to ask the patient to look to the right and to the left. If you notice that the fast beating component of movement changes direction, or you have bidirectional nystagmus, this is indicative of a central cause of vertigo, and the patient could be suffering from a posterior stroke. However, if the patient is only exhibiting unidirectional nystagmus or horizontal nystagmus, this is most likely a peripheral cause of vertigo. Let's review the head impulse test. If the patient exhibits a horizontal corrective saccade, this is a sign of a peripheral cause of vertigo. However, if the patient is able to maintain a fixed gaze throughout the test, their vestibular ocular reflex is intact, which means so is their peripheral system. Thus, the cause of vertigo is most likely stemming from a central nervous system problem. Now we'll review the test of skew. During the test of skew, if when you uncover the patient's eye, you see eye movement, usually vertically or diagonally, this is indicative of a central cause of vertigo. However, if the patient's eye does not move but remains fixed, this is a peripheral cause of vertigo. This is how you interpret your results from the HINTS exam and determine if the patient needs immediate medical attention or if this condition can be treated and managed with physical therapy. Thank you.